Good morning, and thank you for joining the RLS Foundation's webinar titled Navigating RLS in Different Stages of Life, Children, Teens, and Adults. My name is Carla Diezenkowski, and I'm the Executive Director of the RLS Foundation. The Foundation uses Zoom webinars for all webinar events. To ensure seamless webinar access, confirm that your Zoom app is up to date with the current software. If you need help accessing the live webinar on your computer, call the number listed on your registration confirmation email for assistance. If you have any other questions, please email clara@rls.org. Before we begin, please be aware that all attendees will remain on mute during this hour. We thank you for the questions submitted with your registration. Dr. Paruthi will answer as many questions as time allows following the presentation. After the webinar, the recording will be available in our website's member portal section on the next business day. If you are not a foundation member and would like to review this and other recorded webinars, we invite you to become a member today by going to rls.org. As always, individuals suspecting that they may have RLS should consult a qualified healthcare provider. The information offered in this webinar is for informational purposes and should not be considered as a substitute for the advice of a healthcare provider. Today's speaker is Dr. Shalini Paruthi, Chair of the RLS Foundation's Board of Directors. Dr. Paruthi practices in St. Louis, Missouri, where she sees patients of all ages. She has a particular interest in sleep disorders of childhood, obstructive sleep apnea, insomnia, narcolepsy, and of course, restless leg syndrome. Dr. Paruthi is board certified in sleep medicine and internal medicine and received her medical degree from the University of Missouri, Kansas City School of Medicine. She completed her internal medicine residency and sleep fellowship at the University of Michigan. Not only do her patients benefit from her clinical care, but she is also a teacher as well as an adjunct professor at St. Louis University School of Medicine. She has contributed widely to the activities of the American Academy of Sleep Medicine, chairing sleep-focused conferences, participating in task forces, and serving on committees, including the Education Committee and the National Sleep Meeting Program Committee. Currently, she is on the editorial advisory board for Sleep Review, the Journal for Sleep Specialists. Dr. Paruthi, thank you for sharing your time and expertise with us today. I now invite you to begin your presentation.
Well, hello, and I am delighted to be here today to share a lot of information. And so today I'll be speaking about navigating RLS in different life stages, adults, teens, and children. And just to always start with conflicts of interest, I don't have any particular interest other than I will be discussing off-label use of medications at times, and I am a director on the board of directors for the RLS Foundation. So today what I really want to help you with is to be able to navigate the process of being diagnosed correctly. Let's identify best non-pharmacologic treatment practices. We'll review medications for treatment, and we'll do this sort of over the lifespan of adults, teens, and children. So I'll point out where things might be a little bit different for children, teenagers, adolescents. But I think where we're going to spend the most amount of time is just making sure you actually get the right diagnosis or find the right people who can help you. We will just kind of very briefly go over those medications. Now, the good news is that RLS is being actively discussed and studied. And so I wanted to show you, I just did a quick, in PubMed, typed in restless leg syndrome, and you see right away 5,812 results. Now, of course, it's PubMed spans 1947 and beyond. And you really see that explosion of papers recently in the last 10 to 15 years. And I had a screenshot from a couple years ago, and already it's 500 more. So this is really encouraging. So I want you to know that you have a lot of allies here, and we're all trying to figure this out and figure out how can we help people. Now, one of the most important things is knowing what is restless leg syndrome. Do you actually have this? So there is the International Classification of Sleep Disorders, third edition, which has now been revised, and it was just published in 2023. June was the first time you could get your hands on it. And so if we kind of take a look at what exactly are the diagnostic criteria for restless leg syndrome, this is super helpful. There's a lot of words on this page, but I really want to focus on that it's a complaint of an urge to move the legs, usually accompanied by or thought to be caused by uncomfortable, unpleasant sensations in the legs. They must begin or worsen during periods of rest or inactivity, such as laying down or sitting, be partially or totally relieved by movement, such as walking or stretching, as long as the activity continues, and occur exclusively or predominantly in the evening or night rather than during the day. The other thing that's incredibly important here is that the features are not solely accounted for by a condition that mimics restless leg syndrome. So here they've listed leg cramps, positional discomfort, myalgia, venous stasis, leg edema, arthritis, habitual foot tapping. I would add neuropathy here, and we're going to talk about these in a minute or two. The other thing is they say that the symptoms of RLS cause concern, distress, sleep disturbance, or impairment in mental, physical, social, occupational, educational, behavioral, or other important areas of functioning. So this right here is our diagnostic criteria, and this is the textbook that all sleep physicians are using. Now, there's a lot of notes that come along with this, and these mainly, I'm going to summarize here, are that you can get the symptoms not only in your legs, but in other parts of your body. So you can get it in your arms, you can get it in your torso. There is, in children, the difference here is going to be that we really want them to be able to describe the symptoms in their own words. And sometimes using a drawing can be very helpful. The other thing is sometimes for people, once their RLS becomes so severe over time, that maybe it's hard for them to remember that it initially started only in their legs at night. So that's going to be something that's important here. The other thing is you can have other medical disorders that either cause the restless legs or bring it more to your attention in that they worsen the restless leg symptoms, such as people who have chronic renal failure and maybe on hemodialysis. So breaking that back down to our basics. So we have these uncomfortable sensations in our legs, feet, other body parts. It can be worse in the evenings or at night, better with movement, worse with inactivity, and we don't attribute it to something else. Now, in terms of why it happens, people are still trying to figure this out, but I've highlighted sort of what chemicals in our brain are probably most responsible or at least contribute to the formation of restless legs. So one is going to be iron. And by the way, I did want to say thank you for sending in all of your questions. I know we got a couple more even just in the last 24 hours. And so I've taken a look at those and tried to address most of them even within the slides today, but certainly we'll have that open Q&A time as well. So iron, absolutely. Iron is important to create, I should say it's in the formation of dopamine, but also in the transport of dopamine. So very super important for that. The other thing that we're going to see is that there could be a problem with glutamate. So when we talk about the GABA medications, that's where we see that they work on glutamate. We know that there may be something to do with adenosine. We also don't fully understand why opioids work. And then, of course, we know that there are certain medications that are known to trigger or worsen RLS. And so we also see that even in the last year, there's been some case reports of certain medications that might actually be helpful that we don't normally think of either. So this might be, I saw a case report on vortioxetine, which is actually an antidepressant medication that might be helpful for some people, and suvorexant, which is a insomnia medication that works through the chemical orexin in our brain. So we don't exactly totally understand yet, but again, lots of allies who are helping us try to figure this out. All right, so in terms of prevalence, our best estimate is that there are 10 to 12 million Americans who have some restless leg syndrome. About 2 to 3% of people will have symptoms at least twice a week and with moderate or severe distress. Now, I also have restless leg syndrome. I've had it, as we all know, hindsight is 2020. So I did have it in my teenage years, and it was definitely the worst ever in my 20s and early 30s. So it's been better more recently. How to get a proper diagnosis of your symptoms. So most importantly, some of this is going to sound very obvious, but you've got to find a doctor who knows about restless leg syndrome. Keep in mind that within the sleep field, there are 74 distinct sleep disorders. But when you talk about like a field like internal medicine, family medicine, because your doctor is probably going to be, your primary care would probably be an internist or a family medicine doctor, you're looking at over 10,000 different diagnoses. So, sometimes we're frustrated when our primary care doc doesn't know what to do with restless legs, or they might actually be able to help you get through the first couple of steps of treatment. But if your restless legs is more refractory, then it can be you might need more specialized treatment and care. But I always recommend starting with your primary care physician. So if you have a child or a teenager, starting with the pediatrician. And then if you're still not getting the information you need, or your gut is telling you, I need to get more information about this, definitely check out the Restless Leg Syndrome Foundation's website. There is a list of physicians there who have intentionally indicated to us that they want to evaluate and treat patients with restless leg syndrome. And then, of course, the RLS Foundation has done an excellent job of finding centers where you're going to find more physicians who are really in tune with all of the RLS care and treatment options. The other thing that's really important is look for a board certified sleep physician, and keep in mind that sleep medicine as a field is very new. So we actually had, fellowships that were accredited starting in 2006. So that seems like a long time, but that means that really we have about 17 to 18 years of sleep doctors who have now been trained with a full curriculum of all the different sleep disorders. And anyone prior to that, they are still board certified or could be board certified, but they may not have gone through as rigorous of a curriculum that includes restless legs. The other thing is looking for an accredited sleep center. And accreditation is usually done through the American Academy of Sleep Medicine or through the Joint Commission on Hospital Accreditation. And if you look at these and you still can't find someone, then look for a board certified neurologist who treats movement disorders. So here you might have to call a university. So let me walk you through these steps. So here is the website from the rls.org website. So here, if you click on find a healthcare provider, you're going to see where you can actually just input your city and state, and it's going to pull up a listing of physicians again who have let us know that they intentionally want to evaluate and treat restless legs. Second, we have on the same page the quality care centers. So you can see from the map, they're spread out a little bit and clustered a little bit in the Northeast, and we've sort of got this desert here in the Midwest. But on the other hand, a lot of these centers are willing to do even virtual visits, but you'll have to call and find out too. Here is from the American Academy of Sleep Medicine's website. So this is sleepeducation.org. And so they have the opportunity here where you can also, again, put in your zip code, be able to search to find accredited sleep centers. And, I thought, well, what happens if I'm trying to find a neurologist who specializes in movement disorders? So I literally typed into Google neurologist in St. Louis who does movement disorders. And right away, St. Louis University healthcare came up, as well as Washington University in St. Louis. So those would be places that you can sort of get a start, give them a call, ask them who are their physicians who specialize in this. The next step then, of course, once you've got your appointment, is you want to really be prepared for your visits. And so I've listed some things here, like, because I think that the most important thing is going to be communication. So being able to really communicate that this is something that's really bothering you, and being able to identify and explain what those symptoms are and the impact it's making on your life. Because when you tell your physician, I get this like weird feeling in my legs, they may just be like, okay, well, is it going to kill you? And if it's not, they want to focus on more important things that are related to your life and death, like high blood pressure and your diabetes and heart failure and other things like that. So, but if you make it very clear that it's affecting my ability to sleep every night, it's affecting my ability to be alert and function properly during the day, then it starts to carry that more weight. And we just need to make sure we communicate that with our doctors, because they can't read our minds, of course. So there is the IRLS, so International Restless Leg Syndrome Study Group Severity Scale, taking in a sleep log so they can really see, hey, I am going to bed at a reasonable hour and staying in bed for a reasonable amount of time, but I'm still getting terrible sleep because I have this urge to move. There are definitely handouts from the RLS Foundation's website that you can take with you. You can, electronically send them, or you could print them out and take them with you. you always want to make sure you have your list of medical problems, surgeries, your allergies. And if you're noticing that insomnia is the thing that's really a result of your restless legs, then maybe even taking in the insomnia severity index questionnaire, that can be really helpful because then it really illustrates to your doctor, look how significantly I am affected here. So if you just literally type in search, Bing search, whichever search engine you use, RLS severity scale, you're going to find something like this pop right up. So it's going to start off with sort of talking about RLS, and then it goes right into the scale itself. So there are 10 questions here, and you want to make sure that you answer it to the best of your ability. And so, for example, it says overall, how would you rate the RLS discomfort in your legs or arms? And you've got options here: very severe, severe, moderate, mild, or none. How would you rate the need to move around because of your RLS? And so you get a sense of these are the questions that are going to really help you articulate how much you are affected. Taking a sleep log, super important. So I, again, literally into the search engine, typed in sleep log, sleep diary. You can also find one on the RLS website that you can kind of keep track of your symptoms that are specific to RLS with. But this one I just pulled from the um, NIH website. So, and it's got things on here that can actually be really helpful in terms of triggers for restless leg syndrome, but also triggers of insomnia too. So things like, remember, caffeine, like coffee, tea, cola, alcohol, taking a nap, how much did I exercise? So things that can be negative to RLS and sleep, but also positive to RLS and sleep. Things like, the actual times that you're going to bed, how long did it take to fall asleep, how much are you wakening at night? Handouts from the Restless Leg Syndrome Foundation. You're going to find lots of different ones here that you can take and share with your physician's office. Now, here's that insomnia severity index. So, again, it's a quick questionnaire, takes less than a minute to fill out, but again, it really helps you articulate to your doctor to communicate to them how much this is affecting you. So, the first question here is please rate the current last 2 weeks severity of your insomnia. So, difficulty falling asleep, difficulty staying asleep, problems waking too early, and then you get to choose from none, mild, moderate, severe, or very. And then you continue on answering these questions. Now, in terms of your medical history, super important to take a clear list of your medical problems first and surgeries. And this is really helpful because we know that there's going to be certain disorders that can be associated with restless legs. And knowing what those are and what medications you might be on is super helpful when I'm sort of thinking about, as I'm speaking to my patients in the room, all right, could any of these be worsening your symptoms? Or is there anything here that is going to help me clue into what we should do next? So that's where that clear list of medications is very helpful. And of course, allergies, because we never want to prescribe a medication that could cause you more problems. And super important, what have you already tried? Because if I'm sort of going through a list of, all right, well, these are the most common things we might start with, and you already told me you already tried X, Y, and Z and had side effects or whatever problems of why you're not still on it or that it didn't help you, then that makes that conversation even more targeted and better. Now, here's one thing that's going to be really, really important is that we rule out and discuss what else could this be? Because again, restless leg syndrome, when you explain it to people, sometimes people just sort of give you this like really puzzled look, like, okay. And unless someone has really experienced it or has a loved one who's experienced it, um, they may not have any idea what you're talking about. So, leg cramps are super common, and we want to differentiate that. So, remember, leg cramps is your muscle is physically tightening. And a lot of times, most people are going to describe their leg cramps as super painful. I've had leg cramps in my lifetime too as an adult, and oh boy, they are really painful. And you can really feel the muscles tightening there. So with leg cramps, you're going to make sure that you differentiate. And some people will definitely have an overlap of restless leg syndrome and leg cramps. Positional discomfort. So this is where, if you've been, let's say you sat with your legs crossed on the floor or in your chair for a while, and you notice that you sort of get this like weird tingly feeling, but you also notice that if you get up and you walk around or you change positions, it gets better. Well, that sounds a lot like RLS, but it's more of a matter of how quickly it gets better and describing again those symptoms that you're having. Did you really have an urge to move, or kind of that need to stretch, or did you get kind of twitchy? Sort of more of the symptoms that people describe with RLS versus that positional discomfort. Myalgias, so those can actually be like real muscle pains as opposed to sort of that urge to move or that weird sensation that we've experienced. And some of the times when we're thinking about myalgias, one of the biggest culprits is actually those statin medications that we take for high cholesterol. So, again, having that list of medications, knowing what medical problems you have can be very helpful for your doctor. Venous stasis. So, this is where you get a backup of fluid in your veins. And so that can happen sometimes just with aging. I know we don't like to hear that, but as we get older, our veins are no longer as leak proof as they used to be. And so that's where we can also get some swelling in our ankles and our legs, because then that liquid is going to essentially diffuse out of our veins, and then it kind of gets into the muscle area and cause a lot of irritation. And so that's going to be really important that we make sure that we're wearing compression socks if we're going to be up and out and about. Even wearing compression socks for a few hours a day can be super helpful, and they don't have to be extremely tight compression socks. I wear like 15 to 20 millimeters of mercury. I bought mine online for like 7 pairs for 20 bucks. I put them in the washer and the dryer. They're absolutely fantastic. And then in the evenings, I make sure to really elevate my legs. And even when I'm sleeping, I have a pillow underneath my mattress, but above my box spring, so kind of wedged in there, just so that way the foot side of my mattress is elevated by about 6 inches. And we did that all the way across the bed for my husband and I. And so that really helps to reduce and get that fluid out of your legs, so that way your legs are nice and skinny ankles by morning time. Arthritis can be mixed up. Arthritis tends to be more in the joints as opposed to restless legs, which most reports often include the calves. With neuropathy, this can be very difficult to distinguish. And very interestingly, some of the medications that we use to treat neuropathy also treat restless legs and vice versa. So with neuropathy, your doctors will, if they're doing a physical test for that, that's the EMG or electromyogram. And that's where they can test how fast electricity is moving through your nerves and can tell you if there's a problem there. And neuropathy has a little bit different, blood tests that you do and treatment as well. So that's where it's really important. If you're not sure, just find out if you do have neuropathy. And the other thing is, of course, there's habitual foot tapping. So these are the folks that you see everywhere who just bounce their feet or bounce their legs, and they don't realize it. But if you say, hey, stop bouncing, they're like, oh, and they do. But habitual foot tapping is absolutely real. All right, so what's the difference with kids and adolescents? Guess what? Everything I've said so far applies to them as well. So it's the same diagnostic criteria. We're still looking about 2% of children have definitive RLS, although we do know from research studies that about 17 to 20% of kids are restless sleepers. And if that's the reason that parents are bringing their children in to see me, chances are, based on a lot more history I'm going to get, there's a good chance I might treat it as restless leg syndrome, despite them being able to articulate and meet all 4 criteria. But if they meet 3 of the criteria or 2 of the criteria, we may choose to do some testing and then proceed that way. Same pathophysiology that we understand. And so again, just children specific, we'd start with their pediatrician or pediatric sleep specialist or pediatric neurologist. Again, we can look at the RLS Foundation's website for more help in finding the right doctors. Now, as we kind of move on into the treatment options, I think one of the most important things that gets overlooked is making sure that we treat the other sleep disorders that can coexist. And I've had a number of patients that come in, they tell me or describe their restless leg syndrome for sure. But because they filled out this very long questionnaire as a new patient that also asked them about all the other sleep disorders, we recognize that there's other things that could be contributing. And remember that we know that if you're getting poor sleep or not enough sleep, that in itself can make your restless legs worse. So, with looking at all those other sleep disorders, whenever we identify a patient who has a very high likelihood of having sleep apnea, we will actually discuss maybe even evaluating for, so testing for the sleep apnea first, and treating sleep apnea if they have sleep apnea first, before we talk about a medication for their restless legs. And the reason for that is, and I want to make sure that this point is very clear. Sleep apnea does not cause restless leg syndrome. They are not directly related like that. However, if you have sleep apnea, because that can cause such a worsening of your sleep in terms of that sleep duration and sleep quality, that in itself can amplify the symptoms of restless leg syndrome. And I've had a number of patients over the years where we treated the restless leg syndrome, where we treated the sleep apnea. They came back in for follow-up and said, wow, I'm sleeping so much better and I don't even notice my restless legs anymore. We're also going to talk about avoidance of triggers in the next few slides. Treatments that do not involve medications, treatments like supplements, treatments that include the medications. And it's also important to know that as of right now, we only have symptomatic treatment and not disease-modifying drugs. So a lot of times we're seeing these very interesting commercials on TV, so that direct-to-consumer marketing with a lot of biologic medications that have come out for various disorders, but so far nothing for restless legs yet. Here are the only FDA-approved medications for restless legs. So the dopamine medicines like pramipexole, ropinirole, the rotigotine patch, and of course, gabapentin and acarbol. Now, you might say, well, how do doctors even know what should be used for treatment? Or you might say, I want to learn more about what is recommended for treatment. So there's a lot of what we call practice parameters or clinical practice guidelines that have been published by various groups of physicians and scientists. So for example, the American Academy of Sleep Medicine has the treatment of restless leg syndrome and periodic limb movement disorder in adults. Now you see it says 2012. So the good news is this is in the final stages of being updated. So they've done a new review with a new group of physicians and scientists. So we saw that here. And it looks like it's actually fully written up now. And the next step is that it will go to a public comment period. So where people can read it and ask questions or say, this doesn't make sense, or are you sure about that? Although everything, of course, through these guidelines should be evidence-based. So based on what has been published in recent studies. And so we expect that a completed version of this should be out by June 1st of 2024, so this summer, in the next few months. There are also what we call quality measures for the care of adult patients with restless leg syndrome. And so what this document does, and you can just, again, go through your search engine, type in these exact words, and you're going to find these. They are freely available on the internet as well. But this is going to go through, are people being asked the right questions so that way we can increase appropriate diagnosis of RLS? Are they being offered appropriate treatments and in the right time frame so that way we have better treatment for RLS? The American Academy of Neurology also has their treatment of restless leg syndrome practice guideline. There's an International Parkinson and Movement Disorder Society guidelines. There is, of course, the management of restless leg syndrome, which is an updated algorithm from 2021. And these are the Scientific and Medical Advisory Board for the Restless Leg Syndrome Foundation, who went through and created this consensus document. And it is extremely helpful, again, freely available on the internet. So you can print this off or send an electronic digital copy to your physician if you need to. So that way in that visit, you can really talk about what might be good treatment options for you. We also have this huge, wonderful database called UpToDate that physicians regularly subscribe to and use in the treatment of patients. And so I went through there and just took a look, and they have actually a fantastic treatment algorithm there. So lots of little boxes to follow, and it kind of goes down the left side and then continues on the right side there. And so this can, again, be very helpful. This is not going to be easily found on the internet, but certainly I want you to know your physician should have access to this. All right. So when you're in that visit and you're, reviewing your medication list for medications that could cause or mimic or worsen restless legs, you're making sure you're being evaluated for other sleep disorders. Maybe we're going to start with checking your iron status. Oh, and just really quickly, so remember, these are things that can be associated with the symptoms of restless legs and can make things worse. So caffeine for some people is a trigger. Medications wise, antidepressants, most of them are suspect except for bupropion. And the reason for that is most of the antidepressants work through serotonin or norepinephrine, so two of the chemicals in our brain. But bupropion or Wellbutrin actually goes through dopamine. So that's the reason for people who take that as an antidepressant, find that it does not worsen their restless legs. Medications that fall into the category of antipsychotics, the dopamine blocking medications, and then medications like antihistamines. So when we talk about antihistamines, keep in mind there are some people who say, oh my gosh, if I take Benadryl or diphenhydramine, which is the generic name for Benadryl, in the evenings, that can really worsen my restless legs. In terms of medications, so we were talking about those selective serotonin reuptake inhibitors. So these are those antidepressant medications. And we know that about, some studies show even up to about 50% of patients can develop restless legs because of their medications. And the other ones on here are other antidepressants or antipsychotic medications. So we kind of talked about avoiding the aggravating factors or triggers, right? So not getting enough sleep, getting poor quality of sleep, untreated sleep apnea, caffeine, alcohol. Some people would add sugar or salt here. Other medications can certainly worsen the restless legs. The other things we want to talk about that are not medications, but actually work for a lot of people. So doing mental alerting activities when at rest, so working on a computer, doing crossword puzzles, regular exercise is so understated. So making sure you're walking, or if you can, and you've got a stationary bike or go biking outside, even things like yoga, even things like getting in the pool and just moving around and using all your muscles without aggravating those joints. I totally understand. And if symptoms have already started, maybe it's helpful to figure out what temperature works for you. So if taking a warm or kind of warmer, hotter bath or shower. Leg massage is super important. I think one of the questions that I had received, was what if I have restless legs in the middle of the night and I can't get out of bed very easily? So leg massage, so massaging your own legs or sitting up and kind of stretching, even if you're still needing to stay in bed, can definitely be helpful. Now, the last thing on here is pneumatic compression device. And you might say, what is that? So basically, those are leg squeezers. So if you look online, you can type in leg squeezers. You're going to find a lot of different variety of options that are, depending on your budget, relatively inexpensive, anywhere from $30 to $75. And they basically provide a massage because they're going to squeeze your legs. And you can use these for about 30 minutes in the evenings whenever you're having symptoms or even to prevent symptoms. So iron stores, lots of people have questions about iron. And when I explain to my patients why we think that RLS occurs, I always remind them that there's the chemical dopamine that we make in our brain. And either we're just not making enough of it or we're not transporting it properly. And so you have to have enough iron as a cofactor for tyrosine hydroxylase, which is an enzyme, to convert tyrosine into dopamine. And then you have to have enough iron to help that dopamine get out across the blood-brain barrier and then transport that dopamine to the rest of the body. So that's where the iron comes into play. Now, having low iron or having iron affect your actual treatment or kind of the symptoms of your restless legs, getting it better. In adults, it's probably closer to about 30% of adults are going to find that iron is the real cause for their restless legs. In kids, I would say it's closer to about 80% of the time that we're going to see iron be the problem, and treating that and replacing it will make such a huge difference for them. So iron will not work for everybody. That's my main point here. So with that, the consensus is that if you're getting your labs checked and if your ferritin is less than 75 or your transferrin saturation is less than 45%, that you receive a trial of iron therapy. Now, with those tests, the ferritin is an acute phase reactant. And what that means is ferritin is a marker of iron stores and it's in your bones. So anytime we get sick or we have like an acute stress on the body, then the bones are going to send out white blood cells to fight infections and kind of help moderate whatever stress is going on. But when it does that, the ferritin goes up really high too. So it just gets a little confusing that if you've been acutely ill or had this major stress, to see if that ferritin is actually that accurate. So that's the reason we always recommend waiting about 4 to 6 weeks after an illness before you check the ferritin level. So that way it's more reliable, more accurate to use. The other thing is that we know that anytime you have chronic inflammation in your body, you're also going to have a higher ferritin. And so that's the reason that normal ferritin levels are a bit higher in adults. And part of that is because it's pretty common for many of us to develop arthritis as we age as well. In terms of using oral iron, there's a lot of recommendations out there. These are going to be your most common that you find the ferrous sulfate. Lots of different preparations of iron. Believe me, we've tried them all with my patients, myself, my kids have restless legs. We've tried lots of different things. But ferrous sulfate is the one that you're really looking for. If you can take it with vitamin C, even better. You want to avoid taking it with calcium in particular because the calcium and the iron will bind. Then you don't absorb either one ideally. And then, just being sure that you check the ferritin initially before you start the iron, and then every 3 to 6 months thereafter. And the goal is about 100. It's very important to remember that there could be iron overload. So you don't want to just start iron unless you've actually checked it with your doctor. And then you don't want to take iron forever either. So that's the other really important reason for checking those labs every 3 to 6 months or so. The other thing is that, remember, iron comes with possible side effects. So you want to try to find an iron preparation that causes the least amount of constipation, which the risk of constipation across the board for most iron is going to be about 5%. With certain ones, we found it to be even lower. And then the other thing that can be very, very confusing is that most people's stool will turn black or dark green while they are taking the iron. And so that's something to be aware of because we would never want to miss a bleed from the intestines because we didn't realize I was taking iron, but I was having internal bleeding and now I've confused myself. There is now a lot more data on IV iron. So if you need to do that, your doctor will go through all of these things and what's going to be the best treatment, what is going to be available through the infusion center, and they'll go over all of that with you. Now, the other thing is there are these alpha-2 delta ligand medications that we've heard a lot about. And so these are the gabapentin, the pregabalin, the gabapentin enacarbol. So those brand names on there could be Neurontin, Lyrica, Horizont, and such. And so these medications can be very helpful, again, going through the GABA system, so affecting glutamate. And they can treat a lot of other things. So I may even sometimes use a very low dose of gabapentin to help people with their insomnia, even if they don't have restless legs. So that could help with both or something like that. Now, with these, I always recommend start with the very, very lowest dose. So in my adults, I will start with like 100 milligrams. And with my kids, I may even start with 25 milligrams. So finding even the liquid form of that. The other thing that's really important with these medications is the timing. So make sure that you're taking it at least 1 or 2 hours before you expect your symptoms to start. And so that way we can actually maybe even prevent the symptoms from even getting going in the evenings. There are lots of side effects with any medications, and if you open the package insert, they will list, I feel like the list goes on indefinitely, but it does end at some point. And the most common ones that we've had to either stop these medications for or not even try it in the first place would be daytime sleepiness, the dizziness, the unsteadiness. Falls are included there, cognitive disturbance, meaning that it can make it feel like you are foggy in your brain or it's hard to process things. Having weight gain or swelling in the ankles. It can affect mood because remember, these medications are all going through the brain, so causing depression or suicidal ideation. And if you use it with other medications that can affect your lungs, like opioids, then you could have respiratory depression. So these are all things that you want to make sure that you're definitely aware of if you're going to start something or if you're already on it. Now, with the dopamine agonist, one of the first medications that was used to treat restless legs is carbidopa levodopa. And this was a really good question that was also sent in. So, how we started to even understand or sort of think about dopamine being a cause of the restless legs was because in patients who had Parkinson's who were being treated with dopamine medications, people started to recognize that if they also had restless leg syndrome, that seemed to improve. And so that's where, this first idea of using dopamine agonists really came to play. And so since then, there were medications, pramipexole, ropinirole, and that rotigotine patch that were then developed to be longer acting than the levodopa carbidopa used for Parkinson's. So that way that could treat and last people relief through the evenings into the nighttime. And so there's different, properties. Again, your doctor is going to have all this information easily available to them so they can review it to help you figure out which medication might be the best for you. And again, remember, there's a list of possible side effects with every medication. So the most common ones that we're going to see with these dopamine agonists are going to be the nausea, the lightheadedness, daytime sleepiness can be a reason why some people just cannot use these. Nasal stuffiness, constipation, oddly enough, sometimes insomnia, leg edema, and probably the most important things to really be aware of. It's super rare, but definitely can happen are these impulse control disorders. So, gambling or shopping, hypersexuality. And so, these are ones that you want to make sure you let your doctor know at every visit, hey, this medication, I'm doing okay with it. Or we've had some people come in and say, you know what, I started this a few weeks ago and now I find myself online shopping way more than usual. And it's really hard for me to suppress that desire to do that. I've had patients come in and tell me that, like in the first visit, that another doctor had started this and now they feel really guilty or they have shame that they have opened up credit cards that their spouse does not know about, that they're in debt now. So, this is actually really, really important. So, if you find yourself really wanting to go online shopping or to the mall or online gambling or to the casinos, certainly really important. You might need to stop these medications. Now, augmentation has been discussed a lot very recently in the last few years because we know that about 7 to 8% of people will develop augmentation if they're on a dopamine medicine. And what this means is that this is really interesting here. These are the types of questions that are going to happen. Do the restless leg symptoms appear earlier than when they first started the dopamine medicine? And just like when you notice that, like, let's say I get my symptoms get worse, so then I increase my dose, but instead of the symptoms getting better, the symptoms actually got worse for my restless legs. So then I tried to increase my dose higher. And again, instead of the symptoms getting better, they actually got worse. So that's augmentation. And so are higher doses of the medication now needed, or do you have to take your medication earlier, or is it less effective than it used to be? Now, has the intensity of symptoms worsened since starting the dopamine medicine, or each time you increase it, does the intensity get worse? And now is it starting to spread to my other body parts, again, with increasing the medication? So these are what you're looking for if it's augmentation. The other thing is that between you and your doctor, you'll be able to figure out, is this augmentation, or is it that your medication just isn't lasting long enough? Or have you started to just become tolerant of your medication, that it's just not working as good as it used to, but it's still not augmentation? Or are you just having a natural worsening of your restless legs? So, some things we know as we get older, they just tend to get worse. And so this table actually I think is a really great one to go over with your doctor if you're just not sure why your medicine isn't working as well as it used to. Now, the other thing is, we got some really great questions about opioids, and it is indeed true that there is going to be a small fraction of us who get such severe restless leg syndrome, or that we just cannot tolerate the other medications, where an opioid is going to be the best choice. So the great information here is that there's a lot more research being done in this area, and so Dr. Winkleman, who is up at Mass General, has a large registry that was funded through a grant from the RLS Foundation. And so they're really studying how much medication, which opioids are working best, what are the most common side effects, how long do people need to stay on this, how much, do they need to change in their doses over time. So lots of great information coming out of that and being published on a regular basis. Now, again, remember, opioids have side effects too. So think about the nausea, constipation, urinary retention, daytime drowsiness, cognitive dysfunction or being in that fog, unsteadiness. It can change hormones, low mood. Lots of different things can happen with opioids too. It can worsen central sleep apnea or obstructive sleep apnea as well because of the effect of on the lungs not breathing as well. Now, if you end up choosing or your doctor and you decide that an opioid is the right thing to do, again, having those expectations up front and everything being sort of very clear is important. So most people are going to have an opioid contract with their doctor. And what that means is that, you are using it for the reason that it's being prescribed to you and that you're not selling it or giving it away or, keeping it recklessly in your home where if you have visitors that they could get access to it, things like that. That you know what are the possible side effects, so you're regularly thinking about it, looking for those. They have regular follow up visits every 3 to 6 months. Now, you're going to find a lot of physicians are not willing to do telehealth visits for these refills either. So you might need to go into the office for that reason. So that way, they've laid eyes on you, they've had a chance to look at your blood pressure and those other vital signs that we collect, and just overall, they have that confidence that this is still the right medication for you. We don't do early refills, that you have just one doctor who's prescribing your opioids and that you're not changing the dose and just kind of going up on it whenever you feel like it. So these are really important things. And most physicians are going to ask for a yearly drug screen. And then we have things that are prescription drug monitoring systems that we can log into. And a lot of times that's going to give us red flags if someone is getting their medication from different pharmacies or from other physicians as well. All right, so with kids and adolescents, everything is actually really still similar. And I think we kind of touched on these as we went through, but sometimes like kids will have more difficulty describing those symptoms, especially that urge to move. So sometimes that's a very difficult word to articulate or to describe. And so that's where I often have to use other clues like family history. So if mom or dad has restless legs or other siblings, if there's this history of growing pains, we know that there is a lot of overlap between the symptoms of growing pains and restless legs. Now, for growing pains, we know about 35% of kids are going to have some growing pains. If it occurs once or twice, every 3 or 4 months, maybe it doesn't need any more, history taking, evaluation, and treatment. But if it's something that the kids are complaining of, my legs hurt every night or multiple nights a week, then again, thinking about growing pains might actually be restless leg syndrome is something very important not to miss. And especially kids who are going through lots of growth spurts, because remember, iron is very commonly the problem in children, and treatment usually works really well. And with growth spurts, we know that, physical growth, so bone cells, muscle cells, blood cells, all of those need iron as well as the brain cells in terms of the restless legs too. And then again, looking for avoiding the triggers, treating the other sleep problems again is super helpful. So where can I get more information? You might be asking. So again, use the Restless Leg Syndrome Foundation as a great resource for you. So we've got lots of information right on there. And I think the other important thing is you are not alone. So join a support group, even if it's once or twice, see who else is on there and ask us if there's anything that we can help you find. The American Academy of Sleep Medicine also has a lot of really great information about restless leg syndrome in terms of, and again, finding a sleep center if you're looking for one. The International Restless Legs Study Group has a lot of great information on their website as well. And even just again, searching in your engine, you can get a lot of very excellent information from the NIH, National Heart, Lung, and Blood Institute. So NHLBI is the institute that houses sleep disorders through the National Institutes of Health. And if you're looking to see, is there a clinical trial in my area, you can always go to clinicaltrials.gov and type in restless leg syndrome, and then it's going to give you by even where are studies that are actively recruiting for patients. So I want to take some questions here. And again, thank you for your attention. And we are here to be a resource for you.
Well, great. Thank you, Dr. Paruthi. That was very informative. So we'll go ahead and start. The first question is, I'm afraid of going unexpectedly to a hospital and not getting my RLS meds. when needed because of a possible inability to communicate. What can I do to be prepared?
Great question. So again, this is where just sort of being super prepared. So whether you keep a list of your medical problems, surgeries, medications, allergies, keep that list in your wallet, keep a list in your car, make sure whoever is next of kin for you or whoever is your emergency contact has that same list. That's going to be very important. And also on there, if you happen to be able to do this, it's really great to put a little hyphen and why you take it. A lot of times we will see in the hospital that a patient will come in and let's say they're on their dopamine agonist. But usually, if you've been admitted to the hospital, you've got a whole lot of things going on that are pretty close to life and death. And so sometimes, as the physicians are trying to figure out what's happening, some of the medications could be considered non essential, which I understand all of our RLS meds are essential to us who have RLS. And so that's where it's really important to say, if I miss a dose of this, this is what happens to me. So that way it's very clear to them, don't stop it. Just make sure they continue to get it. Also, have your sleep doctor or your restless, whoever's giving you medications for your restless legs, have their phone number to their office right there too. So that way it's very easy for them that they're not having to amongst the other millions of things the physicians and nurses are doing in the hospital, have to then Google or get into that engine search to find your doctor's name and phone number. So have all that information just readily available to them. That's really important.
Okay, what is the long-term consequence for teens with this disease? And then is there a chance for improvement?
Great question. So, when we talk about teenagers with restless legs, we're going to find again, iron is very likely to be the culprit here because they've been having these very large growth spurts, especially that growth right between those ages of like 14 to 18. We find that they're playing a lot of sports at school. So, they may be exercising 3 to 4 hours a day and just, using those muscles and burning through those muscles, which need iron to recuperate and regenerate. Um, and so, iron often is a very big thing. So, with our teenagers, again, we're still looking about 2% are going to have really active restless legs, but up to about 17% of these kids are going to have difficulty falling asleep, staying asleep, being restless in their sleep. We're treating and looking for the iron stores might be the first thing. Now the good news is that once their need for iron slows down again, so once they've stopped growing or things kind of slow down a little bit, we find that actually adults who are young adults, middle-aged adults, the prevalence of restless legs goes way down to maybe about 5%. And it doesn't pick up again until we're kind of in the 50s, 60s, 70s, where we can see up to about 20% of people have restless legs then. So the good news is most likely the restless legs is going to become very quiet as they age into adulthood. Now, things to remember here though is that in pregnancy, we're going to see restless legs in up to 80% of pregnant women. So that may be a time. And again, pregnant moms are just dumping all of their iron stores into growing this new baby. And so we think that's what triggers a lot of restless legs during that time frame. So there are definitely going to be different times in life that it could get worse. Sometimes we don't really understand, and the restless legs will wax and wane through our adulthood. And sometimes people may need medication for just 6 months or a year, and then the restless legs is quiet and they don't need it anymore. So that's also a reason to reevaluate the if you're on a medication, do you still need it? And so I think that that's something really important to keep in mind is that just because you had it in childhood does not mean you'll have it in adulthood or beyond.
Okay, next question is, since opioids are the only meds that work for me and now my doctors won't prescribe them, what are my options?
You got to find the doctor who will help you. So, again, pull resources from the RLS Foundation's website, pull resources, finding a sleep center, find a neurologist who specializes in movement disorders. So, restless legs is something that they're very keen and aware of and know how to differentiate that from other disorders. Find that board certified sleep doctor. You may have to travel to treat your restless legs. And I know that's not fair. I know that, like, we can come up with a million reasons why that is just awful. But the reality is, just because whoever you've already talked to hasn't been able to help you doesn't mean that there's not someone else who does or who can help you.
Great answer. What is the relationship between RLS and Parkinson's disease?
So, just like we kind of shared a little bit earlier, is that again with Parkinson's disease, that's going to be related to less less or lack of dopamine. And so once people started getting treated with the first medication that came out for Parkinson's, which was levodopa carbidopa, people who also had restless legs started to notice benefit too. And so again, it just we know that there's some shared pathology there with the dopamine chemical, but again, medications don't necessarily have the same effect, and also the duration of medications used for each is a little bit different now.
Would someone with RLS be more susceptible to other neurological diseases?
Ooh, really good question.
Mhm.
The answer is we don't really know for 100% sure. So, um, coincidentally, inadvertently, there are going to be people who have restless legs and other neurologic disorders. But as of right now, I would not say that there's a 100% correlation that if you have this disorder, you will definitely have this one.
Okay, I'm going to ask you two questions about diet. So, can an anti-inflammation diet be helpful in RLS? And also, do dopamine-rich foods help manage RLS symptoms?
Great questions. Offhand, I do not know of any foods that are dopamine foods, like that give you dopamine. My understanding is you would have to get dopamine like through a medication. However, foods that are, let's say, high in iron will help you, I guess, send more iron into your gut. So your gut is like there's more iron available for your gut to absorb and then transport, again, help with that production and transport of dopamine that way. Um, in terms of having an anti inflammatory diet, that is a really great question. And I'm going to give you a little bit of a different example here to kind of illustrate this point. So, my short answer is yes, it's probably helpful to have an anti inflammatory diet if you can tolerate those type of foods. The reason being is there are some gastrointestinal or GI disorders that cause a lot of inflammation in the lining of the small intestine. And the small intestine is where we absorb a lot of nutrients. So if you get inflammation there, then the little cilia projections that pick up the nutrients, those can get swollen and irritated. So then they don't do as good job of absorbing. So if you are able to decrease the inflammation and allow the parts of the small intestine to really heal up, then you have better or improved absorption of minerals and vitamins like iron. And so, for example, we know that people who have celiac disorder, if they avoid gluten products, the inflammation often improves and then they absorb their iron better. So there's lots of reports of people with celiac disorder who treat it and now don't have their restless legs anymore. So anti-inflammatory diet is probably helpful.
Do you have any recommendations for RLS that interferes with your performance in the workplace?
Ooh, that is a really good question. So, if you find that standing, walking is very helpful for you, you might see if it's possible to get one of the standing desk. I've seen different variations of this. So, I've seen where it's whether it's made out of plastic or wood or something, but it's adjustable. So, you can stand up whenever you want to and work at a kind of higher height, or you can lower it and then sit at your chair. Um, Making sure you take a break. So whether if you can find yourself sitting, you're able to sit comfortably for 30, 45 minutes, and then you need a 2 to 5 minute walk around break. Some people will get like these pedal, like it's not a full bike, but just these little pedal things that you can put under your desk. And so that way they can do that for a little bit. I have also seen if your workplace allows it, and some people find that, if their feet get really cold and that really irritates their restless legs, you could think about a space heater, but do not leave it on for long periods of time. Do not burn down your workplace. Like, make sure you use it safely.
The next question is, how do seniors in care facilities who have dementia and RLS avoid being administered drugs that will aggravate their RLS?
I wish there was a perfect answer to this question, and there really isn't. So, again, communication, communication, communication. So, making sure that, the folks who are going to be caregivers understand that restless leg syndrome is real, that, this person has it, and why, if they are on some medications, why they should not miss it. Make sure the timing of the medication is right. That is so important to making sure that these medications work. Um, it's really hard that if your symptoms get started, many of you already know this, if your symptoms are already started and you take your GABA medication or your dopamine medication after your symptoms have already started, you may or may not get that same relief. Whereas if you had taken it a couple hours before your symptoms started, it really either prevents it or decreases that intensity a lot. So, again, communication is going to be really important with the caregivers.
What should you do when you notice any changes in your RLS symptoms?
This is a great time to, one, do a reevaluation of what have you done differently. So maybe you have now found a trigger for your restless legs. Maybe you changed a medication. Maybe you over-exercised, under-exercised, or you had some sort of stress event in your life or an illness or something like that. Maybe you ran out of your medication, you forgot to pick it up at the pharmacy. So kind of check in with yourself and sort of see what's going on that's different here. But if after like a few days you're just like, this is definitely something not right, that's a great time to put in that phone call to your, whether it's whoever again is treating your restless leg, so your primary care doc or your sleep doc or your RLS doc, your neurologist, whoever's helping you with that.
Okay, and then our last question is, can RLS be brought on by menopause?
Ooh, definitely a great question. I have not seen anything very super specific to that. However, I have not hit menopause yet, but from my patients and just learning, reading life things, I would say that there's just so many changes going on with the body. If RLS occurs during menopause, it's still really important to, again, see if you can figure out and treat it. So, whether that looks like, again, identifying those triggers. Was there a new medication that you started? Because there are some people who will treat hot flashes with a particular SNRI, venlafaxine. Could that be what's triggering the restless legs if it's something new? Um, there's a lot of mood changes that come along with menopause, so maybe there's a new medication started for that. So again, it's going to be really individual specific, and so kind of focusing on how intense are the symptoms, when are they happening, I guess the frequency, and see if it warrants more evaluation and treatment.
Okay, well, thank you so much, Dr. Paruthi. We really enjoyed today's show, webinar, and also for everyone for tuning in. Join us for the virtual summit on that will be on April 6th. So go on to the foundation website at rls.org and register and join us. It'll be a day filled of research. And so you'll get to hear the late breaking news of what's going on and what people are doing in the world of RLS research. So take care, everyone, and have a great afternoon.
Thanks for having me.
Mm.